satellites. Starlinks are satellites. Yeah, two Starlink trucks. Oh, you better. There's cell services crowd down there.
There's 2,300 people that live in the entire county.
Yeah.
None of them is
It's fun to visit. Really pretty area.
Yeah, it's nice.
It's amazing. Kind of, pretty close. Yeah. We had some friends that had a cabin down there, so they sold it, but we went down there every year for about 6 years or so. Real pretty red rock. Good four-wheeling. Good place to shoot guns. Good stuff down there.
Isn't Goblins Valley a pretty coast?
Yeah.
Public information officers here at DHHS. This morning, we're going to talk a little bit about measles and what the situation is here in Utah. First speaker will be Dr. Leisha Nolan, our state epidemiologist, and she'll be followed by Amanda Jocelyn, who is a nurse practitioner working in southern Utah. Come on up, Leisha.
Thank you for coming here this afternoon. Unfortunately, we called this press conference because we are still seeing a spread of measles in Utah. I believe, just for you to all be prepared, so we have graphics for you, and so hopefully you gave your email to Brielle and to Charla, and we can give you graphics that will illustrate some of the information I'm going to give you right now. But quickly, right now we have identified 650 people who have had measles in Utah. That is tragically high. But really what is concerning to me is we are seeing spread of this disease through our entire state now. For a while it was really limited to the southern part of the state, but it is now expanding and we are having people diagnosed in every part of our state. And these are not just mild infections. We've had over 120 people go to the emergency room for their measles. We've had 31 people have to be hospitalized overnight for their measles. And we have 3 people who've gone to the intensive care unit because of measles. Happily, I do not have to say at this point that we've had anybody die of measles, but it makes me very nervous to have this many people get sick with this disease, that we might in the future have to report that. So today we are coming to people across Utah to really remind them how this disease is spreading and to take whatever precaution they can to protect themselves against it. So at this time, we have seen spread in a number of different situations. The one that we think is particularly notable is we're seeing spread in a number of different school activities. So we have definitely seen people get infected with measles from wrestling events, from dance drill teams, and from basketball. So we really encourage people to protect their children as best they can. The measles vaccine is the best thing to protect your child. It is how we can stop this infection. And so we encourage people, if they or their child are not vaccinated, to have their child vaccinated against measles. It is at this time a real threat in our state and something we can do to stop it. So I went to one of the communities in Utah that's been hardest hit by measles just about a month ago. And while I was there, I talked to a number of providers and a number of individuals who have had measles. And I talked to them about their experiences, what happened, and what they'd like other people to know. And over again, what I heard from these people who had measles, as well as the providers, that measles is so much worse than what they expected. It is not a mild infection. It is not a mild virus. It is severe illness. And they kept on telling me they wish they'd known beforehand how bad measles was so that they could have protected their family. A number of them clearly said if they'd known, they would have vaccinated themselves and their children against measles. But they didn't realize how bad it was. So I really want today to let people understand or give people information so they understand how serious this infection is. For that reason, we invited someone who has treated patients with measles very recently in our state. Amanda Jocelyn is a nurse practitioner in Southwest Utah, and she has seen patients with measles. So we asked her to come today to share some about what she's seen as she treats people in Utah.
Sorry for interrupting, but we just wanted to clarify we have 353 cases of patients with measles that have been diagnosed since June of 2025.
Thank you for inviting me here today. My name is Amanda Jocelyn. I am a nurse practitioner in the southern Utah area with nearly 20 years of experience in pediatric primary care. For nearly 20 years of my career, I have read about, prepared for, and educated my patients about measles, but I have never encountered a case in the clinic. That changed over the past few months, during which I have personally cared for more than a dozen cases. This reflects what most providers across our region are now seeing. We now know that measles is circulating again in our communities. My goal here today is to share firsthand clinical observations and experiences to support families, inform our communities, and encourage care. Many people think that measles is just a virus, that most children recover from if they're otherwise healthy. While it is true that many viruses are self-limiting, my recent experience has shown me how severe measles cases can be. The children I am seeing in clinic with measles are very, very ill. And in several cases, their parents and their caregivers get ill as well. Their common symptoms they have is they have high fevers. These fevers are 103 to 105 that last several days, up to a week. They have severe coughing that causes hypoxemia. That's a condition where they can get low oxygen and they require home oxygen treatment or hospitalization for oxygen. They can develop pneumonia. I've seen several kids develop pneumonia from it, and they have a long, long recovery. Some cases I've seen have had some more serious complications. I've seen a case of aplastic crisis. That is when the bone marrow kind of shuts down red blood cell production, and then the body becomes extremely anemic and therefore is harder to recover from it. I had a healthy young mother come in that also developed measles-induced hepatitis, where it's inflammation of the liver. This required her to be hospitalized and have intensive care treatment. These are just a few experiences I wanted to share firsthand that highlight what we all are trying to get across as a message, that measles is not a mild illness. It's highly contagious virus. It can lead to serious complications, and even in otherwise healthy individuals. Because measles can spread through the air, and it can linger up to enclosed spaces for up to 2 hours after an infected person leaves the clinic, the region and many clinicians and caregivers have implemented precautions to limit exposures in the clinic. These measures are used to help protect vulnerable patients, and these include infants, they include pregnant mothers or caregivers, and those that cannot be vaccinated, such as immunocompromised patients. Despite these challenges providing care to families affected by measles, providing care remains a priority to us caregivers. I have often completed a full clinic day and then garbed up in precaution gear and been able to see a patient after hours in a safe environment in order for them to not come into clinic and potentially expose vulnerable individuals. I do this because early evaluation and timely support, they do matter, and no family should feel hesitant to seek care for children. I feel it's important to say that if you think you have the measles or you've been exposed, we as clinicians wish that you would call ahead, or you call your primary care provider, you can call the ER, you can call the urgent care, your lab, and tell them if you feel like you have an exposure, because we can put proper precautions in place to prevent further exposure within the clinic. I'm hoping that when we communicate about cases, we can make sure that we don't come off accusatory, but we come off compassionate, and we come off dedicated to providing care for our patients. And my last message I kind of want to relay is I can give a family and I can give patients all the information that I feel like that they need in order to make decisions, but ultimately it is the family's choice and decision how to care for their child and how to proceed. Thank you.
Thank you, Amanda. And I am going to make a corrected statement. My team just pointed out to me that I said something very wrong at the beginning. So I will say the case count again, because obviously my brain was not fully functioning when it said it first. So at this time in Utah, we have 358 people diagnosed with measles. Of these people, we know that over 120 of them have had to go to the emergency room. 31 of those people, or 31 of those people, sorry, have had to be admitted for their measles overnight, and 3 of them have had to go into the intensive care unit. So I just wanted to put that out so we have the correct numbers. But thank you, Amanda, so much for talking about your clinical experience. And we really want to remind people that the best protection against this is the measles vaccine. This is a vaccine that has been used for decades. I certainly got it as a child. Most people in Utah have gotten it. But it is important to make sure that you're fully protected. So if you haven't been vaccinated, or if your child hasn't been vaccinated for measles, we really encourage you to go get vaccinated against measles so that you don't have to have this kind of outbreak in your family, have these kind of medical effects in your own household. We also want to mention again that if you have a baby who's under 1 year old, there is an option to have them have an early dose of the measles vaccine. They can have it as long as they're 6 months old, and that is something that can help them protect them against the measles virus. Usually babies don't get that vaccine until they're 1, but because we're in the outbreak right now, we are recommending people talk to their doctor about protecting their baby when they're 6 months old. We also do want to mention that babies who are little kids who haven't gotten their second dose are able to get their second dose actually just a month after they get their first dose. Usually babies get the measles vaccine when they're 1 and they're 4, but there's actually not a really good reason that they need to wait until they're 4. So if you have a little kid who's 1, 2, 3, and you haven't gotten their second dose of measles vaccine yet, you can go ahead and get that, and that makes sure you're a little bit more protected. And then last, we encourage all adults to review their medical records with their doctor or their physician and make sure they have had 2 doses of the measles vaccine. It is the best protection that we have, and we really encourage people to use that protection. So I do want to remind people what Amanda was just talking about. If you do think you might have measles, we encourage you to stay home. Don't expose other people. This is a highly contagious virus, and we don't want to spread it around. If you need medical care, we certainly want you to go in to get medical care, but call ahead so that you don't expose other people in those situations. Let the providers know that you think you might have measles so they can protect other people when you come in for your care. And then last, I just want to say that we all have the power to do this. Utah can stop this outbreak. There is a vaccine that is highly effective against measles, and we have the option to work together to stop this outbreak and really keep everybody healthy and safe. With that, I am happy to take any questions and provide any more information. Yeah.
Did you say the numbers were since June
Of 2025. So it's our entire outbreak, so yes.
What percentage of the sick people are vaccinated or under-vaccinated?
Yeah, so the vast majority of people who are getting infected with measles are people who are not vaccinated. So we have about 8 to 10% of people who have gotten infected are people who have had at least one dose of the vaccine. That is in dramatic contrast to our population. In our population, 90% of people have been vaccinated against measles. So it shows us just how much more it is hitting the people who are unvaccinated than by hitting people who are vaccinated.
I'm sorry, go ahead.
It's unfortunate that we do have some people who are vaccinated get measles, but we know there is no such thing as a perfect vaccine. There's no such thing as anything perfect. So we know that it is when so much measles is spreading in our community, we will see some people who get the virus even when they're vaccinated. So the fact that we have that 8 to 10% getting measles is not showing the vaccine's not working. In fact, it's showing it really is.
Is this considered an outbreak, or how do you define it?
Yeah, certainly this is an outbreak. It's quite a prolonged outbreak, and we are trying our best to protect people, but it is one of those things we all need to work together as Utahns to get this under control.
I'm pretty sure I had measles when I was a young boy.
Yeah.
Am I immune? Once you have it, you build that immunity, or?
Yeah. So measles is something that you get once and you are protected. And so a lot of older people have had measles when they were younger. If you were born before 1960, it's very likely that you actually had measles as a kid. And so a lot of older people will have had it as a child. Those people are immune and considered protected against it.
What areas of the state have been most affected?
So we continue to see most of the infections in southwest Utah, but unfortunately we are starting to see more and more infections in other areas of the state. We really haven't had a single part of the state escape this right at this point. We certainly are seeing people throughout. I think it continues to be mostly southwest, but it's spreading more and more.
And what community did you visit that you said that was being hit hard?
Yeah, just one of the communities on the Utah-Arizona border. So, yeah.
Cool.
One last one from me. Is the severity, if you're partially vaccinated, does it reduce severity?
Yeah. So certainly the data previously was that if people have been vaccinated and then go on to get measles, that they're going to have a milder disease. We are also seeing that in Utah. The people who are unlucky and are vaccinated and still get measles tend to have a much more mild disease. Their symptoms resolve much faster.
Is there special guidance for pregnant women?
Yeah, so pregnant women are we're very concerned about people who are pregnant who might get measles. Happily, if you're pregnant and you're vaccinated, you've protected yourself and your baby. But people who are pregnant, unfortunately, we can't give them the vaccine. The vaccine is not something that's safe to give while someone's pregnant. So for that reason, if somebody is pregnant and hasn't been vaccinated, it is very concerning to us if they are exposed to measles. We do have the possibility of giving them a special medicine, but it does not work nearly as well as the vaccine. So certainly, if you're someone who's thinking about having kids, I would really talk to your doctor about getting that measles vaccine so you can be not worried about that during your pregnancy.
Any quarantine implanted?
Sorry, what did you say?
Any quarantine?
So we do recommend people who've been exposed to measles who aren't vaccinated and don't have that history of being sick with measles a long time ago. We do recommend they stay home and away from others for 21 days. Measles is an infection where you get sort of very generic symptoms in the beginning. It looks a lot like a cold, and I think we all know there's a lot of colds going around right now in Utah. So people start out just having a fever, a cough, red eyes, runny nose. So it seems like a lot of other things. So those first few days, it's hard to know you have measles, and that's where we know people are most likely to spread it to other people. After those first 4-ish days of general symptoms, then they get a rash, and that's when most people will realize they have measles, but by that point, they've possibly infected a lot of other people.
Any protection at school?
Yeah, schools, so we do work with schools to identify people who might not be protected through vaccine and make sure that they're aware and that we do the right precautions to try to limit spread in schools as much as we can.
In our schools where we're seeing the most outbreaks?
So the schools that we've seen the most outbreaks tend to be the schools that have the lowest number of kids vaccinated. And unfortunately, that is what makes sense. Having an unvaccinated group of people is where the virus can take hold and spread. So if you have a large number of kids who aren't vaccinated, it's easier for the virus to spread in that type of school.
Any issue with the supply of the vaccine in the state?
No, the vaccine is easily available, and so certainly anybody could talk to whatever provider they usually see about getting a measles vaccine.
Thank you all for coming. We appreciate it. We appreciate you paying attention to this important public health issue. Thank you.
Thank you.